Attorney General Peter Neronha is outlining a new plan to tackle Rhode Island's healthcare crisis. Thanks for joining us. I'm Kim Kalunian.
I'm Mike Montecalvo. The AG says the crisis affects Rhode Islanders' ability to find a doctor and be seen quickly at a hospital. Hannah Carter joins us now live from Providence. And Hannah, this was a pretty sweeping announcement by the Attorney General.
Mike and Kim, the AG laid out a lot of information today in a nearly 2-hour news conference, including a newly filed lawsuit and proposed legislation that he says would help stabilize the system.
We are in a state today of spectacular failure that is literally occurring before our eyes. We're not ready to treat the problem as seriously as it is, and in a sense, suffer the pain it's going to take to fix it.
Attorney General Peter Neronha is pressing lawmakers to pass several bills. One would remove prior authorization requirements for primary care providers. Another would increase state Medicaid reimbursement rates to match federal Medicare rates for PCPs. When asked how much that would cost, Neronha said it could start somewhere in the $50 million range.
Let's do a poll of Rhode Islanders and ask them what should be at the center of our budget planning. And I guarantee you, healthcare will be in the top 5, maybe in the top 3. It's not optional to fix healthcare. I don't think Rhode Islanders think it's optional. And if that means pulling money from somewhere else, then we need to do that.
The Attorney General is also suing CVS, Express Scripts, and Optum, the country's top 3 pharmacy benefit managers, for allegedly driving up prescription drug costs. A CVS spokesperson says Neronha used, quote, biased and incorrect assertions about the industry and that limiting how PBMs operate could increase prescription costs. Writing in a statement, in part, quote, just last year alone, we saved Americans more than $40 billion on their prescription drug costs. Our members pay, on average, less than $8 per 30-day supply of medication. Now, Neronha has been critical of Governor Dan McKee's prior initiatives aimed at strengthening the primary care system. In a statement, a spokesperson for the governor said, quote, the governor has made it clear that the determination of new rates needs to take into consideration not only the differing rates within the New England market, but also the differing costs of living and doing business among the New England states. This approach ensures that we do not increase the tax burden on Rhode Islanders more than is absolutely necessary to be competitive, especially in the current financial environment. Reporting live in Providence tonight, I'm Hannah Carter, 12 News.